nation can witness development and progress in any area of human endeavor under an atmosphere of epidemics, ailments, and diseases. As such, delivering efficient healthcare services to the people, even at the remotest part of the society, is the responsibility of government at the federal, state, and local levels. Even though the people themselves have a major role to play in ensuring that they live hale and hearty lives, it is the duty of the government ministry overseeing the health affairs of a state as well as other agents in that sector to put in place proper mechanisms to create awareness and educate the citizenry in order to have a healthy society. The administration of Senator Ibikunle Amosun of Ogun State since inception has been taking holistic steps towards achieving this healthy society status for the state. The vision is to make healthcare efficient and easily accessible for everybody in the society, irrespective of geographical location, standard of living, or age. This is in line with the second cardinal program in the agenda of this administration's mission to rebuild Ogun State. The government of Ogun State, under the leadership of Senator Ibikunle Amosun, upon assumption of office, quickly recognized the fact that though provision of healthcare services to the people is the responsibility of government, it has continued to encourage partnership with various bodies and organizations to ensure efficient healthcare delivery to the people. One of the fruits of this partnership recently saw the state receiving drugs worth about $3 million from the Shell Nigeria Exploration and Production Company, SNEPCO. SNEPCO has been a reliable partner with the Ogun State government under a public-private partnership or PPP arrangement towards boosting healthcare delivery to the people of the state. Aside this, the state government has put in place fundamental structures that have seen tremendous achievements being recorded in the area of healthcare delivery to the residents of Ogun State. Some of the successes in this sector that have contributed to quality healthcare for the people include the overhauling and rehabilitation of both primary health centers and general hospitals across the state, regular sensitization programs, initiatives towards creating awareness on polio and measles, as well as acquisition of standard hospital equipment, and also training and retraining of health workers and other support initiatives in different areas of healthcare delivery.
The emphasis of this administration is on keeping people healthy, and the way you keep people healthy is to arm them with knowledge. So we're expending a lot of energy and resources on a whole host of public enlightenment activities across the various areas that concern us. Today we are dealing with HIV/AIDS, we are dealing with malaria, we are dealing with maternal and child health, we are dealing with tuberculosis, we are dealing with so many aspects of helping the citizenry become part of the health service, part of the prevention of ill health.
Towards boosting healthcare services, this administration has also focused on recruiting human resources into various agencies and departments to fill the vacuum that has been created by lack of manpower in some parts of the health sector. A massive recruitment exercise was the option adopted by the government in order to increase efficient healthcare delivery on the one hand, as well as reducing the rate of unemployment in the state on the other hand.
Recognition that both in preventive and curative health, that the healthcare personnel are at the core of service delivery, and this government has recruited, by now the number is well over 1,000 healthcare workers. It's on an ongoing basis. We did have a large recruitment program where in one go we took on about 780 healthcare workers. So we're trying to repopulate the depleted health workforce that's delivering services to the people.
Aside these efforts, the administration has also emphasized equipping the people with the knowledge they need in order to take control of their health. After all, knowledge is power. To this extent, awareness campaigns on various health matters continue to be organized by those in authority for the people of Ogun State. The first step taken by the government in the crusade of eradication of measles was the state-level training on preventive measles campaign organized at Hilltop Hotel, Onikolobo in Abeokuta. This was in September 2013. This session was basically pre-training for technical facilitators and health officers for the planned campaign against measles in the state.
Measles is a serious disease that affects children, and if we don't get rid of it in time, if we're having problems of morbidity and even death of our children. So this campaign is very, very instructive, and we are happy that the government is putting all our resources to getting the disease eliminated.
The integrated measles campaign took place at Abeokuta South local government from the 1st of November 2013. At the flag-off ceremony, nursing mothers were sensitized on the imminent dangers of measles amongst children. The event witnessed a large turnout of women signaling success in the campaign even from the initial stage of the program.
Measles is one of the 6 childhood killer diseases leading to death among unvaccinated children, and it's a major cause of childhood blindness in Africa. It's an infectious viral disease causing fever, red rash on the skin of susceptible children. Despite the fact that it is a vaccine-preventable disease, many children less than 15 years of age are at risk. In Ogun State, measles vaccine is routinely given to children of 9 months of age in all health facilities to increase their immunity against the measles virus.
The Honorable State Commissioner for Health, together with the Executive Chairman of Abeokuta South Local Government, kick-started the vaccination by immunizing children at the event. Gomoro kits, an initiative of the Governor's wife, Mrs. Olufunsho Amosu, were also distributed to mothers.
Thank you, sir. Thank you, sir.
The campaign rally for measles was then taken to Abeokuta metropolis. On the first day of this immunization exercise, the monitoring team of the measles campaign and OPV vaccination went round to ensure that the exercise was going on well as ascertain that every part of the state is covered in the process. Among the places visited on the first day was Kugba Primary Health Center. Children within the ages of newborn to 5 years were brought out in their numbers to be immunized. Mothers were asked to register before administering the vaccines on their children. The team also visited Fajo, Odeda, Oshele, and Obantoko primary health centers, amongst many other centers.
Madame, don't close camera now.
The Ogun State Governor's wife has also complimented the efforts of the state government in its bid to enlighten the people and make them aware of their responsibilities in health prevention and management. One of these efforts is the breast cancer awareness and screening exercise for women across the 3 senatorial districts of the state. This program has become a yearly event. This year's breast cancer awareness started with a program tagged Jog for Life on the 19th of October 2013. The walk started from MKO Abiola Stadium in Kuto to Abeokuta Grammar School. The motive behind the walk is to exercise the body, since regular exercise is a prerequisite for staying healthy.
The actual cause of breast cancer is not known to any scientist. Even doctors that have been treating the condition don't know the real cause. But something that is clear to us is that we know things that can lead to it. Now, the jogging experience today was to demonstrate one of the things that can be avoided. And that is when you live something we call sedentary life, which means your life is not that is filled with activity. But jogging is a form of activity. It takes off the stress. So when you hardly exercise, you are unnecessarily gaining weight. You engage yourself in taking some meals that are not so healthy and things like that. Many more things they can predispose to this unhealthy condition, and it can eventually lead to breast cancer.
Mrs. Olufunsho Amusu, while addressing market women during the walk around the Kuto area, sensitized the women on the significance of checking their bodies on a regular basis and urged them to go for the screening where provision has been made for it.
We're explaining to people that they need to be aware of their bodies, to take note of changes in their bodies, and that if unfortunately they do notice that there are some changes in their bodies, be it their breast or some other parts of the bodies, they should go to the health center and get it checked out. And if unfortunately they do find that they do have cancer, then they should get it treated immediately, because it is curable if it is detected early.
The screening exercise followed immediately after some lectures were presented. This cancer awareness drive was replicated across the 3 senatorial districts of Ogun State, so that more and more women are reached with the message of cancer awareness as the solution to curbing this disease. Mrs. Olufunsho Amusu expressed her profound gratitude to all those that gave support to her office in one way or the other to facilitate carrying out the exercise successfully, as well as saluted the courage of the women for their cooperation and understanding.
I want to single out and particularly thank M1 for supporting this course on a yearly basis, because without you, this program would not be possible. So I say a special thank you to you. However, like one of the doctors said, it's important to take advantage of this opportunity.
HIV and AIDS prevention and control is not something that this administration takes lightly. It has embarked on training of young people, especially on health matters, particularly HIV and AIDS awareness, under the Ministry of Women Affairs and Youth Development, as well as in collaboration with the Ogun State Agency for the Control of AIDS. Thus, towards marking the 2013 World AIDS Day, the state government lined up several activities to generate more awareness.
The goal of World AIDS Day is to raise awareness on HIV/AIDS prevention and to highlight the importance of HIV counseling and testing.
A special Jumu'at service was held at Kobiti Central Mosque, Abeokuta, where the Muslim faithful received free HIV tests and counseling.
Nígbàdé mo ti dìde lónìí ni mo ti sọ gbogbo wa pé ká dúró ká fi etí sílẹ̀ láti gbọ́ nípa àwọn tó ń bá wa sọ yìí, nítorí ibi téèyàn òrò sí ló ń gbà yọ, ẹni bá dẹ̀ ṣọ́ra ẹ̀ lọ́hùn ṣọ́ kó ní kálukú ká ṣọ́ra wa kọ́lọ́hùn lè ṣọ́ wa.
On Sunday, the 1st of December 2013, a special church service was held at St. Peter's Anglican Cathedral Church, Ike, to commemorate World AIDS Day.
0 death-related, HIV-related death. That means òní sí ikú nípa ilé àwọn èèyàn kó àrùn wọ́n kó kòkòrò HIV tó di AIDS tó wá di pé ó máa já síkú àfẹ́yìn wọn.
In the early hours of Tuesday, the 3rd of December 2013, The Ogun State Ministry of Health, in collaboration with the Ogun State Agency for the Control of AIDS, organized a walk in commemoration of the day. The walk started from Okeata Housing Estate to Itaoshin Motor Park. Leaflets containing vital information and facts about HIV/AIDS, as well as packs of condoms, were distributed to the people along the way.
The state is doing a lot, and you can see that a testament to that is the fact that our prevalence rate has remained stable. We're not one of those states that is losing control of the epidemic. I have to say, however, that it's something that you can't relax your vigilance on, and we are doing this constantly. Although this is World AIDS Day, so we are doing a particular outreach, but I have to tell you that we do our mobile HCT, that's HIV counseling and testing. Our mobile services are on fully across the state on a daily basis, and we have comprehensive centers in every single local government where everything is available.
The importance of this of the campaign and the sensitization is to increase the awareness beyond the level that we have now, because the level that we have now is still not the gold standard, and we still expect a lot of people to have an uptake of the awareness so as to influence their behavior in terms of living positively and avoiding sexual risky behavior.
At the park, a formal awareness campaign program was organized to sensitize the public about the necessity and importance of knowing their HIV status. The Honorable Commissioner for Health, directors and heads of departments and agencies within the ministry spoke to the people about the significance of the World AIDS Day and the numerous benefits coming from the government of the day, in line with the provision of free healthcare in this regard. Free HIV tests and screening was also conducted for members of the public at the occasion. It is sure that the government of Senator Ibikunle Amosun is exploring all options to ensure provision of adequate healthcare delivery to its people. The efforts of the Ogun State government under the leadership of Senator Ibikunle Amosun